Hello, so my name's Sarah. I'm a research physiotherapist and I'm based at the Move Lab at Newcastle University working with Mike's team. I'm actually here today on behalf of the sports, health and fitness team at Newcastle because they're all so busy delivering exercise on referral programmes that they couldn't be here today. So go easy with the questions because I'm presenting it on behalf of them. Okay, so what are exercise on referral schemes? Well, they're exercise schemes that seek to increase someone's physical activity levels. And basically what happens is you would go to your GP, they would identify that physical activity levels are a problem, and then they would refer you on to this service. It might not be your GP, it might be your physio or your occupational therapist. There's a few different professionals that could refer you. So then you'd be referred to an exercise on referral scheme. A personal assessment would be made of the individual by a physical activity specialist, and then you would participate in a physical activity programme. So these vary, and what I'm going to do today is discuss the programmes that we have in Newcastle. Now, obviously everybody isn't a Newcastle resident, but this is just a general overview of the service that we have here. So if you wanted to get this service within your area, it would be a case of speaking to your GP or speaking to your physio and seeing if this service is provided. And the government do recommend that this service should be provided, so it may well be up and running in your community. Okay, so this is the sports, health and fitness team in Newcastle upon Tyne, and we work quite closely with this team with the Move Lab. And their goal is really to maintain health and well-being for Newcastle residents. So they have three main schemes. They have a Live Well scheme, they have a Why Wait scheme, and they have an On The Go scheme. So I'll talk about Live Well first of all. So Live Well is basically for people with underlying medical conditions and different risk factors. So everyone would fit here. So it's a health programme to increase physical activity, and it's under the safe and friendly guidance of the sports, health and fitness team. So who's it for? Well, this service is specifically for people who live in Newcastle and for people who attend a doctor's surgery in Newcastle. And it's for people who have a health condition for which exercise is recognised as being beneficial. And it's also a service for people who are 16 and over. So what happens? Well, there's lots of different exercise services that they provide. One of them is exercise in gyms, so using different bits of equipment, treadmills, bicycles, that type of thing. One is access to swimming at public swim times. And the other is health walks, and they're available across the region. And actually, my mother-in-law's done quite a few of these, and they're really quite good. Okay, so where is it on? So it's on in the east of Newcastle in Walker Activity Dome and East End Pool. In the centre of Newcastle, it's at Eldon Leisure. And to the north, it's at Gosforth Pool. And to the west, it's Elsick Pool and the Centre for Sport. And the Outer West Pool. So how long is the programme? Well, the programme given in Newcastle is 12 weeks in all. So you have a pre-consultation in week 1 where it's one-to-one. You meet up with one of the health and physical activity specialists and they go through what your goals are in this programme and do some very basic measurements with you. Then there's a 10-week intervention, and that's very much determined by what you want. And then there's a post-consultation at week 12 with the person that you saw originally, and then they give you ideas about how you can take this forward if it's something that you're interested in. So how much does it cost? Well, the good thing is it's free in Newcastle, and it's to all who qualify, as it's funded through public health. So where can I sign up? As I've said, this is for people in Newcastle, but the best thing to do is to go to your GP or your registered health professional and they can refer you onto this service. So I'll just talk briefly about the Why Wait service. So that's really aimed at people for weight loss, and it's a similar type of programme. It's a 12-week programme with an initial consultation and a final consultation. Okay, so if you wanted more information about the Newcastle service, the phone number is up there. I've also got some leaflets with me, so if you come and speak to me afterwards, and there's an email as well. So does anybody have any questions?
Experience is that the more I exercise, the faster the deterioration in the condition, that's very, very marked. So while I accept that, that if you maintain your activity, you can move more, but you just deteriorate faster.
I think Grania might be the best person to answer that.
I think one of the talks coming up would be very relevant to you, which Sandra Lars is going to give, and it's really about sometimes what we find with a lot of people, as we all might do, we feel one day really energetic, so we do so much, and then for the next 2 or 3 days we're paying for it. And what we're trying to say, it's about trying to modulate what you do and try and keep it on an even keel. So I absolutely agree, if you overdo it, you can end up causing damage. But what we're trying to encourage is actually trying to try and make it a more even spread, be it everything you do every day, or if you are going to actually have a structured exercise program. And the premise of today and today's talks is very much about individualized or exercise prescription. So as Sarah said, for people living in Newcastle, we're giving you a little taster of where you can go to be referred to. But irrespective of where you are, speak to your health professional. If you see any of us in the clinic, come and speak to us, and we'll try and source if there's a potential referral in your area. But every exercise or physical activity program you undertake needs to be specific to you. It's no different than if you're prescribed a drug. So a doctor wouldn't just put something in the post to you and say, oh, take that, and you wouldn't question it. Same for exercise, same for physical activity. Make sure that it's appropriate to you and what's been, for the condition that you have. So what we're going to do is take a couple of minutes. If you have any other questions for both speakers so far, for either Professor Tunnell or for Sarah.
I have trouble with cardiovascular exercise. Any cardiovascular exercise is painful.
Right.
So obviously, any exercise is uncomfortable to the least.
Mm-hmm.
Would you recommend?
So any exercise that you do is painful, it makes it...
Certainly,
yeah. I think it's going to be very different for each individual person. Where specifically, is it general pain or...
Well, where I think exercises with pain.
Yeah. I think it's about finding the right thing that suits you, and a lot of it is about pacing as well. So it's finding about the right amount of activity that you can do that's not going to bring on that amount of pain.
Obviously, any cardiovascular exercise, or exercise.
Yeah. So, but it could be, does walking bring on the pain, or?
Walking is severe in the back. But generally, most exercises.
Yes, come on up.
Not very good sensation.
So one of the things that we've noticed is, and we've done this in lots of different people, that we do have to tailor it for each individual. Now, come along and have a chat with us afterwards. There's some nice tailoring. There's another message in there too, that we appreciate that this isn't easy. But there's the other side, that if we don't support you to maintain a more active lifestyle, that actually we might be making the disease accelerate. So we're trying to find ways to help manage things like pain, some of the barriers. We appreciate that it's not going to be easy. In fact, it's much more difficult. But the benefits that you will gain by maintaining an active lifestyle are even greater. So yes, we get the complexity of it, and that's why we're wanting to talk with you today and show you the array of things that we have available. But please come and have a conversation. There are things that you can do where you don't use the cardiovascular system, about using muscles that don't put a stress on your lungs and on your heart. But it's about keeping the muscles moving. But please come and chat with us, and we'll provide individual advice as much as we can do throughout the day. But we're not being evangelical about it. We're just trying to say that it's actually important to keep moving. And that's the challenge for us, and we appreciate it's not easy. Any other questions? Shall we move? Sorry. Oh, is there another?
Sorry, was there one more question? Yeah. Oh, yes.
Did you say that most places you can access this for free?
It really depends where you're at. There's a massive postcard lottery, unfortunately, with these services. I think we're very lucky in Newcastle because we can access it for free. I know kind of just across the water
I don't think anywhere in York do it for free.
Really, really, yeah. I mean, it's different
Might
because
be
I know
surprised, but
yeah, my husband's actually a GP on referral instructor, and he works at, in Northumberland, so kind of up at Morpeth, and they do pay a small fee for their exercise on referral. So, particularly if you've kind of done the program and then you want to continue, then you would have to pay a small fee, but it's really variable. So it's a case of going to your GP and seeing what's available.
yeah, okay.
Sorry, it's not perfect. It's not a perfect service. Okay, thank you.